good morning, my dear. I am registered midwife, Bernard. I will be doing your booking today. And of course, booking really is us getting to know you and you getting to know us. Right? If there's anything that is going on, we try to detect and treat before baby is born, if there's anything. Alright, so welcome to the Grandville Health Center. We now begin. Alright, so we got your address and your phone number. Do you remember the first day of your last period?
Yes, the 12th of December.
And that was the first day that the period started?
Yes.
Alright, 12th of the 12th of December. Alright, so your due date is the 18th of September. And that makes you 11 weeks and 5 days pregnant, right? Am I correct? Have you done an ultrasound?
No.
No, not as yet. Alright, how many times have you been pregnant?
This is the 4th time. Last
pregnancy. Alright, how many babies alive?
2.
2 babies. You had 1 miscarriage?
Yeah.
Alright. Any twins in the 2?
No.
No twins. What year? You're a twin? Oh, wow. What year was the last pregnancy?
2017.
2017. And that baby is alive?
Yes.
Alright. In the previous pregnancies, were there any complications?
No.
Any excessive protein in the urine? You had any swelling of the hands, feet, face? Alright. Was it a complicated delivery? Was it vaginal or cesarean? Any surgeries?
No.
Blood pressure went up any at all?
No.
Any excessive bleeding?
No.
Was it a difficult delivery?
No.
Alright, all was well. Alright, anybody in your family has any history of high blood pressure, diabetes, asthma, cancer, any medical condition that we need to know about?
Yes, my son is asthmatic as well as my mother.
So son and brother has asthma. Alright. You have any medical condition that we need to know about?
Just a trait of sickle cell.
Alright, so you have sickle trait. Alright, and we'll talk further about sickle cell afterwards. Alright? Have you ever done any surgery before?
No.
Okay. Are you allergic to any medication or food items?
No.
Are you currently on any medication at all, which would include vitamins?
Yes.
What are you taking?
Natal and folic acid.
Alright, so Natal and folic acid. You have it with you?
No.
Okay. Alright, have you done any blood tests since becoming pregnant?
No.
Alright, so today we will be doing your blood test. So we're checking for 6 things to be specific. However, we'll only be taking 1 sample, so don't worry. Alright, so we'll be checking for your sickle cell status. Of course, you would have already been advised that you have the sickle trait, but we still do a repeat sample. And that is what we do in pregnancy for your first blood studies. Alright, so we're checking your sickle cell status. We're checking your blood type, right? Which we call a group resource. So if you're A positive, B positive, such the like. We're checking for your HIV status. We're checking for your syphilis status. Alright, we're checking for your blood sugar. Alright, we also call that your RBG, and we're also checking for your hemoglobin levels, what we call our blood count. Alright, so to rule out anemia pretty much. Alright, so that will be done in a few minutes. Have you ever taken any family planning method before? Condom pills, injection, copper tea, just condoms? Alright. Were you using a condom when you got pregnant? No? What happened? You wanted another baby?
Really, I just don't like it.
Okay. Alright, so in that case, we would put. You have your immunization card with you? No, you didn't bring it? Alright, ensure we get it the next visit. Alright, because we need to see if there's any outstanding vaccines. First, you need to understand that there are some vaccines that are okay in the pregnancy, like the DT vaccine that will give you for the lockjaw. Alright, if you're deficient on the MMR vaccine, that cannot be given in pregnancy and that will be given after you would have had your baby. Alright, so we need to see your immunization card so we can know your vaccination status. Alright, so please put it on your reminder for next visit. Alright. Alright, so we said that you are 11 weeks and 5 days. You would have already done your blood pressure and that was normal. Alright. And the pulse rate was fine also. Let me see the legs, any swelling? Alright, wonderful. Alright, how old are you now? Alright, so how are you feeling about the pregnancy? Are you happy? Are you sad? Are you just going along? How are you? Tired? But you're happy?
I was very sick in the first month.
Alright, wonderful. Thank God. Just continue praying and you should be fine. Is your partner okay also? And he's supportive? Alright, very good, very good. Any smoking or drinking since you found out that you're pregnant? Alright. Are you working?
Yes.
House do you live in? Board or concrete? How many bedrooms?
Concrete.
How many persons living there with you?
4 of us. Very many.
You have electricity?
Yes.
Running water?
Yes.
What do you do with your garbage?
This home of the
Okay, and the truck comes and gets it. Okay, so when you leave it off, what they do, burn it? Or the truck come and collect it? Alright, good. Who is going to be at home to help you when you have baby? Who is going to be financing you? Alright. At what age you had your first period? 12 years old. How many days does it last? 7 days. Alright. Is it regular or irregular? Regular. 28 days. Okay. Do you think you're eating okay? Alright, so you try to have a balanced meal, you know, your food from your animals, your leafy products to prevent, to help you with constipation, because, you know, as a pregnant woman, you know, the likelihood of you being constipated is higher. Alright, have your fruits, your vegetables, hydrate yourself accordingly. Alright, and you take your vitamins. Have you started shopping as yet? Alright. Bear in mind that when you start your shopping, even though the ultrasound might say it's a girl or it's a boy, remember you do your unisex colors. Alright? And reason being, I have dressed quite a few boys in pink. Mind you, they look really nice, but you know, you want to save the color choosing until after the baby is born. Right? So if you buy all pink stuff, and then you know how the story goes. Also, do sizes, different sizes. Don't just buy newborns and 0 to 6 months. Stretch it out. Do your 6 to 9 months, do your 18 months. So you have clothing up until about at least 18 months or 2 years. Alright? That way you don't have to be going back to shop back and forth all the time. And even so, for the pampers and the wipes, if that's what you're gonna do, you want to stick to a brand. Because if you start with one brand and then you keep switching, the baby might have a reaction by way of chafing, alright, and then it becomes a challenge. Right. You want to make sure too that your bag is packed for 7 months, just in case, alright, and that would be 28 weeks, 28 in between thereabouts. Right? So you want to have most, if not all of your stuff at that time. Right? Alright, we need 2 persons to give blood for you by now and delivery. Alright. We don't ever go into labor and delivery expecting the worst, but sometimes things do happen, and if we end up having to give you blood, we would need to replace it. And hence the reason why we ask for blood donors. Alright? How they come. So you had the vaginal delivery first and the last.
Vaginal 2002. You want to know about the baby last? That was in 20.
Alright. The 2002 baby, you went up to term 9 months? Okay. Alright. The next pregnancy, what after 2002 was?
Sorry, 2012.
Okay, so 2000, oh, not 2002.
No,
2012. Okay. Alright. That was the first. Second one, what year was that?
2006.
And that was the one. Alright. How far in the pregnancy were you?
3 months.
Okay. Alright, next.
And then my son now 27.
And that was a vaginal delivery also. Alright. Went up to 9 months also. Alright. Alright. Alright, so today we're going to be talking about exclusive breastfeeding. And exclusive breastfeeding is really giving baby nothing but breast milk for the first 6 months of life. It is very much attainable. I am a living testimony here. Bear in mind it was challenging, especially for myself as a healthcare provider, where I had to be out for 16 hours or more sometimes, but I made it work, right? The only thing that is permitted for baby for the first 6 months of life, along with the breast milk, is medication. Right? So your Panadol, pain and fever, Cetamol, pain and fever, whatever, pain and fever medication, it is okay, you can give it to the baby. Alright, baby doesn't need any water, baby don't need no fruit juice, baby don't need no bush tea, baby don't need anything. No glucose. Baby you don't need to touch anything at baby's mouth. When they say you're eating, you must touch some. You don't need to do that. Baby has the entire life ahead of him or her to have all the food in the world. Right? Now, you can start expressing also. Right? So if you have to step out to go to the hairdresser, you go back to work, baby still can get breast milk. So you start expressing from an early stage where if you have extra breast milk, most times when baby is suckling from one breast, right, the other one is running freely. You use the opportunity to catch that one. Alright, and you store it, you write the date on it. Today is the 4th of March 2022, and the time, let's say 12 p.m. You put it in the freezer. Right? So, as I said before, we want you to exclusively breastfeed your baby. And so, whenever you express the milk, you date it, you put your time on it, and you put it in the freezer, right? Now, if anybody is going to be staying with the baby, you just warm some water, or some persons have their bottle warmer, you can use that. You know, you don't boil the breast milk because you will destroy the properties. You don't put it in the microwave, you put it in a warm water, not too hot. Once it's thawed out, you throw it in the baby's cup, and that is breast milk, alright? And so, that is how you will do your breastfeeding if you have to step out. And that's what will help you in achieving your exclusive breastfeeding status. Alright? When the baby reaches the 6 months, then you start incorporating your meals and stuff with the baby. We will move on to your sickle cell status. Of course, you said that you have the traits. Alright, and it's good that you already know your status. As we said before, we encourage you to bring your partner along so we can get him tested also to know your status. Of course, how sickle cell works, trait plus trait equals a 1 in 4 chance. So if you have 4 children, pretty much that's what you see. At least one of them will possibly come with a fully blown sickle cell. Alright? And if you know anything about the sicklers, trust me, it is not a field day in the park for them. Pain and anemia is their main discomfort. So they're always in pain, especially as you said, even though you have the trait, you still have a little discomfort whenever the time is cold, right? And what really is sickle cell? The red blood cells are normally round in shape. For the sickle cell, the red blood cell has a deformity in shape, and because it is deformed, it doesn't slide through the blood vessels as it is expected to go. So they stick together and they clump together and they block the blood vessel, and that's what causes the pain. Also, for the red blood cells, the normal life of a red blood cell is 120 days. Now these sickle blood cells are lasting 30 days, 40 days. So you realize that they die quicker, which leads you to having a low blood count, also what we call anemia, which is a decrease in the oxygen carrying capacity of the blood. So you realize how technical this topic is, alright? But at least you're a little bit more wiser now that you know that you need to get your partner tested, alright? And so I hope for the best in the outcome that he doesn't have it, and the worst case scenario, I mean, the baby comes negative for either the trait or the full blown. Alright? So we would have spoken about all of that. We only have your blood test to be done. Alright, as I said, we're checking for those 6 from the 1 sample. Alright, and we'll do a full head-to-toe assessment because, of course, we need to know what is going on with you. If there's any abnormalities, we need to detect and we need to treat, as we said before baby is born. Alright, so that we will do now. I will give you some more vitamins and then you'll be given your appointment. Alright? Good. So we'll go ahead and do your head-to-toe assessment.